With the acceptance of the new SAS contract in March this year, specialty doctors and associate specialists will need to start to prepare for the demands of the new contract. With me today is Dr. Ashok Pathak, Chairman of the SAS Negotiating Committee. So, Ashok, what is the purpose of the job planning process?
Broadly speaking, it's a prospective agreement that sets out doctors' duties, responsibilities and objectives for the individual doctor in the coming year. In most of the cases, it is built upon the doctor's NHS current existing commitment. It is a systemic activity to produce clarity of expectations between the trust and the doctor to meet their individual objectives. Now, job planning should be undertaken in the spirit of partnership and balance the needs of the patients, the individual doctor, the trust and the whole of the NHS. It is key to success of the new contract. The job planning process should not be used for the wholesale configuration, but should be based on your current National Health Service commitments.
So basically, trust should use it as a way of changing people's jobs.
You're absolutely right. The trust should not use that as an excuse to alter your job plans to meet their needs. It should be based on your current commitments to the health service and the job plan that you have.
What should my job plan contain?
There is no single model for a job plan. They will take many forms, but all are expected to contain for example, your main duties, your responsibilities, your commitments, your schedule of your commitments, where you should be, when it should be, your personal objectives, their relationship to the wider service objectives. You and your employer should agree to support the resources that you need to fulfill your objectives. For example, a lot of our colleagues don't have offices or have secretarial support. PCs, etc. These are the things that you should be asking for and come to a mutual agreement.
Obviously, Ashok, sometimes there's going to be differences in opinions between employers and employees. So what happens when you don't agree with your employers about the the contents of your offered job plan?
When it's not possible to agree to a job plan between yourself and your clinical manager, then it should be referred to the outstanding issues to the mediation and appeals process as is set down in Schedule 5 of the Terms and Conditions of the service.
What is the BMA doing to help doctors undergoing the job planning process?
There is a checklist on the BMA website which is a 2-page document. It advises doctors about the job planning process itself. And I would strongly recommend that our colleagues have a look at it before they embark on this process. There is also an electronic job planning diary. It should run a cycle of between 8 to 12 weeks and at least one rota cycle. There is also guidance on how to use an e-diary. That again is well documented on the web. Then for those who are not very familiar with the electronic diary, there is a template which again our colleagues should use to substantiate their job planning process. There is also a joint guidance between the NHSC and the BMA which has been agreed on the terms and conditions of service and the job planning process, and they should again look at that very carefully and use it to their full advantage.